of today's show is brought to you by Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. Well, when it comes to women's health, information is key. Knowing what's going on with your body can really help your doctors, from your cardiologist all the way to your OBGYN. So Dr. Tara Dahl from Health Diagnostic Labs is back to talk about how the Women's Health Assessment can help you and how important this is. Hi.
Hi, how are you?
Doing well.
Good.
Okay, so we talk about health in general a lot with you, obviously, and how the testing can help everyone. Specifically, though, for women. So talk about that, how the assessment's
women
different.
in the various stages of life, we go through a lot of changes. I mean, when we're adolescents, we go through potentially things with PCOS, irregular periods, things like that. And then obviously women of childbearing age have issues there. And then in perimenopause, there's also, unique issues that women experience. So we've created really a panel that kind of addresses issues specific to women. And a lot of it is the same kind of things we've been talking about, those particles that identify risk much more accurately, actually, than traditional cholesterol panels. Many women will have normal cholesterol panels and have abnormalities with this.
Are the panels age specific then?
Well, they're customized based on age, right?
Okay.
So in a pediatric population, I'm going to do a more limited, panel, of course. And then as women get older, we may do some additional tests that look at effects that women have when they're older, like
Let's talk about that.
Issues like, yeah. Well,
Let's talk about this age group, 40s, 50s, where menopause we're knocking on the door of it.
Right.
So I would imagine hormonal changes and all sorts of things.
Hormonal changes can play a role. I mean, we've talked a lot about vitamin D, omega-3 levels. Interestingly, omega-3 has been associated with almost an anti-aging. So if you have a high omega-3 index, that's meant to be, a good thing for aging.
A good thing.
So yeah, so we look at tests like that. We a little bit more likely to be insulin resistant, and that's when women have trouble gaining or losing the weight that's in their abdomen, and that's something that we can discover looking at the insulin resistant markers that we have on the panel. And I think that just gives you insight as to why is it I'm doing everything right, I'm eating properly, but I just don't feel well, I'm fatigued, or I'm gaining weight in the middle, and what am I doing wrong?
I'm eating everything they're telling me to eat. What's wrong? I can't seem to lose weight like I used to.
Right. So we can identify with the testing that we do areas where there are very specific things we can do with diet to make a difference.
And so what sort of things, besides diet, would you tell someone to do at that age?
Well, besides diet, I think the lower carbohydrate diets work best for people, especially as we're aging. I just see more women respond to that as far as weight loss, especially abdominal weight loss.
Is that the insulin thing?
It's the insulin thing, yeah, because of carbohydrates, right? And I'm not saying, don't eliminate carbs completely, because I think that, we shouldn't be doing extreme diets, but trying to get rid of the simple carbohydrates, the simple sugars, refined foods, things like that, processed foods, which have a lot of, things in them that make us, not feel well. I mean, I think a lot of preservatives and things can really, impact just our overall feeling of wellness,
really just causes inflammation everywhere, doesn't it?
Right.
And that's what you can see in your testing.
Yeah, and then we see inflammation, we see, vitamin D deficiency. A lot of women become B12 deficient. I noticed that, so we check that pretty routinely in most panels that I do on a woman. And then, understanding the genetics for heart disease and diabetes, that certainly become more prevalent as we age.
Yeah, because we've gotten used to maybe taking our health for granted, but this really helps us to sort of get a glimpse into what the future may hold, and really kind of get a hold of some of those issues and change them. Can you talk for just 1 minute about inflammation and sort of what that means and what it means for us, especially for women as we age?
Right, so inflammation can come from various sources. I mean, it can come from something internally, so we can have a disease state that creates inflammation, so rheumatoid arthritis or other autoimmune issues. But we can also have inflammation that comes from toxins that we get from our environment, either things that we're consuming, products that we're putting on our bodies. We slather lotion all over ourselves, and we find that, some of the products have all sorts of chemicals in them that are getting into our body, and that can create inflammation. As the body becomes more inflamed, that can affect, blood vessels, that can cause the ability of these bad particles to kind of get inside the blood vessels and create plaque. So inflammation can actually drive the formation of plaque that leads to heart attacks, which we don't always think about that as causing heart disease, but it certainly can. And obviously just feelings of, joints and general fatigue can happen as a result of, having a lot of inflammation, right?
Yeah. So interesting, and of course your testing can give us a view into that as well,
Absolutely, and really kind of help target and individualize care for women so that you feel better and can be your best self. as we age.
I love it. You have to have it done. Okay, so talk to your doctor if you're interested in getting the HDL test. We'll have Dr. Dahl and her colleagues back with us every Tuesday to learn more about how their testing can help you and your family. It is so very important. You can get more information about the Health Diagnostic Laboratory by going to their website, hdlabinc.com. You can also call them at the number on your screen, 877-4HD-LABS. And we're back with more broadcast right after this.